improved the surgical outcomes of our patients in lower blepharoplasty, they have also been acknowledged to increase asymmetries, and this is a paper from just last month, PRS. So I set out to develop a method to detect and assess lower eyelid asymmetries, define and classify its patterns, and probably even measure these asymmetries if possible. In order to do this, I analyzed the digital images of 204 patients, consecutive patients that came to my office for facial surgical procedures. I used the software program Photoshop CS3 Extended, which allows the measurements in the images. And of course, I did exclude different patients with previous 90% of them have lower eyelid asymmetries. And what was even more surprising was to find out that out of these patients that are asymmetric, almost 2/3 of them had the right lower eyelid in an inferior position to the left one. It was extremely surprising for me. So as conclusions, I have presented to you today what I think is a powerful and precise tool to evaluate and measure lower eyelid asymmetries. I think it's a simple and fast way to visualize and document lower eyelid asymmetries with the diagram I presented to you. And of course, I think the classification is also very useful for lower eyelid asymmetries. The findings were that 90% of patients have lower eyelid asymmetries, and what was very surprising, a significantly high number of patients are negative, have the right lower eyelid in an inferior position to the left one, almost 2/3 of them. And I think that being aware of these asymmetries might better help us surgeons to plan our procedures, especially when we're doing lateral canthal support techniques. And I also believe that making our patients aware of these asymmetries might better have them accept these asymmetries post-operatively. So thank you very much.